Ustun.
Good afternoon.
We are here today in your clinic in Adana. And could you please introduce yourself to us?
Okay, I'm Dr. Yakup Üstün. We have our clinic in Adana, and I've been using Navident for more than 3 months. And it is a really interesting adventure for me to use Navident because I like technology, and technology guided implantation is really an interesting point for me. After I started using Navident, I saw that the benefits of the system is really great, and you can place your implants according to the plan, and it guides you during the surgery, and it is instant guidance. So you have much more information during the surgery, so you feel much more comfortable during the surgery, and the patients are much more willing to have the implants placed into their mouth. Secondly, the system works very quick. I mean, starting from the entrance of the patient to the clinic till the time they leave the clinic, it's about 45 minutes to have all the stents, and then in-office digital imaging, I mean three-dimensional volumetric tomography scanning, and then taking the patient to the operating theater, and then having the implants placed. So that's very interesting for the patient also, because the chair time is really reduced, and the results are really perfect if you are especially getting used to using Navident.
That's great to hear. I also understood that you recently became a Navident Master Clinical Trainer. What is the purpose of taking up this role?
Well, the system works perfectly, and I saw that this is a benefit to both the patient and the surgeon and all of the dentists. So I wanted to share all this technology experience to both my colleagues and the patients, so that everybody can benefit from the system. And I would like to share my experience, because every day more and more patients you're treating, and then you're getting more and more experience. So I will try to share my experience to both my colleagues and patients.
That's great to hear. As a last question, can you perhaps tell us a little bit about your latest work with Navident?
Yep. Today, for example, we had 2 patients here operated. One of them was upper lateral incisor case on both sides, and they were post-extraction sides, partially healed for 1.5 months at the most. We could easily place the implants in the right position and in the prosthetically driven way. So I'm really comfortable that after the implants are healed, they will be perfectly, the upper structures will be perfectly produced, and the patients will be happy at the end. I mean, because by using Navident, you can place the implants according to your prosthetic plan. I mean, you plan the crown first, and then you place your implant according to the crown position. That's really interesting. As a also clinical trainer, we also provide over-the-shoulder courses here, right in the clinic, and anybody who wants to have more information about Navident and clinical usage of Navident, we would be happy to share our experiences.
Thank you very much, Dr. Ustun, for the